Hi, welcome to talking about on Zoom. Today I have a great program scheduled for you. One familiar face and a few new ones from AIDS Center of Queens County. Just wave as I introduce you. Rosemary Lopez, Executive Director.
Yay.
Dawn Douglas-Blackburne, Associate Executive Director. Rajeen Hicks, Director of Housing. Our friend Judy Pedraza, who's been on the show numerous times, Program Coordinator of Transitional Housing. If I say it incorrectly, correct me later. And Elizabeth Myers, Program Coordinator, Education and Prevention. So thank you all for being with us in this whole new world. We were chatting a little bit before the show and just experiencing the world as it's changed over the last few months, and it's going to be different for a while, and we need to face that fact, and that may or may not change the way we access necessary services for different portions of communities. And AIDS Center of Queens County provides so many of those essential services to people in need in the HIV positive and HIV prevention communities, and that's such an important thing to address as we move forward through COVID and hopefully beyond COVID, when we're all kissing and hugging each other again in the same room.
Definitely.
So yeah. So with Rosemary, it's like, can you give us a little bit of an overview of exactly, for those who don't know, what Acqc is and what services are provided?
Yeah, this is Acqc's 35th year of service. We were supposed to have a big gala this year in October, and everything has really stopped. But Acqc has been in Queens. It's the largest HIV and community service provider in all of Queens. We have 5 sites. We're based in, our main site is in Jamaica, but we have a site in Woodside, we have a site in Far Rockaway, and we do all comprehensive services, wraparound services for the Queens community. And you can be HIV positive or not. You can be chronically medically ill and be serviced at Acqc. We service over 10,000 clients, where we have, as you said, prevention services, we have housing services, we have mental health services, we have an Article 31 mental health clinic, we run a Syringe Exchange, we do harm reduction, case management, food programs, nutritional programs. We're throughout Queens, an active community food pantry, where in this pandemic, we've been servicing over 200 clients at any given site, our 3 primary sites, on a day that we service the community. We've been getting additional funding, whether through Robin Hood, whether through AHF, AIDS Healthcare Services, AIDS Healthcare Foundation, which is our sister agency, which is our affiliate, who's really helped Acqc with the struggles during the pandemic, financial struggles, or just being able to have the services out there and continue them. We've been very lucky. All of our staff have been working. Our essential staff have been on site every day, whether it's for the food pantry, whether it's for Syringe Exchange, whether it's for housing. They've been coming in every day. Our other staff have been working remotely. There has been no stop in services for the community or our clients as this pandemic has been going on. I mean, our staff are unbelievably remarkable. They're out there, they're delivering food packages to people's homes because people have been too sick to come in. I have to tell you, Queens was the epicenter of the virus. I mean, we were losing staff, we were losing clients, community members, a lot of our clergy, I mean, we lost a lot of people. It was very scary. In this whole world, I've been in HIV for over 30 years now. And I was there with the onslaught of people becoming HIV infected and people being afraid about the stigma, about what would happen if they service someone. This was similar to that because nobody knew who had COVID, how you could get it. At that point, you weren't wearing masks. I mean, we were really in the front line of all of this, and the staff at Acqc rolled up their sleeves and did everything they could to help the community. And that's what we do here. We help the community.
Yeah. Well, I mean, I've been doing the second and third shows that I did of this 25 years ago were with Acqc. We did programs on safer sex, one geared toward men and one geared toward women. And through all that time that I've peripherally been involved, Acqc has always stepped up.
Yeah.
And it's wonderful that through this crisis and beyond, Acqc will be there to step up. And I want to reiterate throughout the course of this, and that doesn't come without people contributing and donating. You're a nonprofit, and on the website acqc.org, people can find out how they can help you as well. And we're gonna touch on some different ways throughout this program, but I want to keep reminding the viewers that you can help, whether it be financially or however volunteer programs have adapted through the crisis. There's information on the website as to how to do that. Is that correct?
Yes, yes. On our website, it shows you how to donate. I mean, for us as an organization, where we see a lot of the need is obviously in food and also in housing. I mean, we really had, in this whole epidemic, we were able to permanently house in 3 months' time close to 40 people. I mean, who does that in a pandemic? Mm-hmm. Finding them permanent places to live. So that means our staff were out there, our staff moving them in. We now have a resource, but we need more resources to help in emergency housing funds that are so needed. I mean, security deposits, furnishings for apartments, things that our clients need to be able to live independently. As we know that when I first started to work in this field, connecting people with medical care was the #1 need, getting them into medical services. And through the AIDS Healthcare Foundation, we have medical services on site. We have a pharmacy on site. But now the #1 need of people coming in is to be able to find them permanent housing and to be able to find them housing that they can sustain, which is very difficult in Queens, which is why I'm part of advocacy groups around housing. How can we work together to let people be able to stay in Queens? We're really many times having to refer them out of borough, and when we have to refer them out of borough, they lose their support services here in Queens. They lose their friendships, their families. They have to be reconnected to another community, which is difficult, which is really difficult. And we have housing. We have Regine on, and we have Dawn on, and Judy on that are our experts in housing.
Well, stable housing is the foundation of resolving so many other issues within the community. Okay, stable housing addresses homelessness. It can benefit in harm reduction and reducing substance abuse, and in finding employment. How do you apply for a job if you don't have a permanent address? I know there are different aspects of the housing programs within Acqc. Can we kind of break that down a little bit?
Sure. Regine, do you want to talk about the housing, or Judy?
I'll start with Regine, and then we'll move along to Judy.
Okay.
All right. So Acqc is comprised of 9 different housing departments. We have a HOPWA program, Housing Opportunity for People with AIDS. We have a HASA program. We have Judy's program, which is the Transitional Housing Program. We have a Ryan White PHS program, which is our independent living, housing placement assistance. And we also have a New York 3 program within ACQC. ACQC right now has 130 leases in the agency's name, and we just got a mini grant for an additional 50. So we're going to have 180 apartments of supportive housing in the agency's names, which we're very excited about. It's a bit of a transition, but we're excited to have house 180 clients in our supportive programs throughout New York City. We have another program called Client Engagement Services, which it's through the City Council discretionary funds, which we get every year. It's a small program which we help outreach in the community to shelters and other homeless facilities to house clients through that grant as well. Our HPA program, we're contracted to do, on the HOPWA contract, we're contracted to house 70 clients per year.
Okay.
And we've been very successful in doing so. And on our Ryan White contract, we're contracted to do 48 placements per year, which we've also been very successful. So we have a great housing program here. We get over 250 referrals in half of a year, and we try to go down that list and house as many people as we possibly can through those programs.
People who have benefited from it, and I've been to one of the apartments, and people are being placed into nice and secure places where they're safe. So it's wonderful. Is there a typical client or a most common type of client that comes in, and what might be his or her story?
Well, typically the clients have a history of homelessness. All of our clients are HIV positive. A lot of them have mental health issues, which we have a wellness program that we house our mental health clients. We also have a harm reduction housing supportive housing program for clients who have a history or are actively using substances. So and then we have our independent living program, and then we have Judy's program, which is the temporary housing, which she'll talk about in a little bit. So we have a variety of different programs that caters to all of our clients' needs. And then we provide support services where we go out into the community. We do home visits. We follow up with their medical care. So it's never stopped. We continue to provide services even once they're housed.
That's wonderful. That's wonderful. Judy, how does the transitional program factor into the overall larger housing programs?
Our clients are referred through HRA. Everyone is HIV positive and homeless or at risk of being homeless. And they are sent to our program. We rent 50 rooms from the local YMCA. There are several different homeless programs in the building. And our clients come here, they get a room with TV, air conditioning, and 3 meals a day. And my team works with them to help them stabilize and to help them find housing. We are very fortunate that we are connected to ACQC. We're able to refer our clients to many of our own programs. We refer a lot of our clients who have been lost to follow up with medical care. We refer them to our clinic and our pharmacy, and that has been wonderful for us. Many of our clients have been in the street for a long time, particularly at this time with COVID. Mm-hmm. And they come here, they're kind of lost. And we try to help them get settled. My team has been working through the pandemic since day one, and they even were able to house over 20 people from March through today, which is pretty incredible. And a lot of that is with the help of ACQC. And I believe it's also our good relationships that we have with the supportive housing programs. Mm-hmm. And many of our clients need to be in a supportive type of housing program. They have a history of substance use and or mental illness. And it wouldn't be fair to just put them in an independent apartment without having done that before or still be actively using. But we do it. And the team has been incredible every day. They've had to help pack up clients. We had one client who had COVID. He was put in isolation overnight, and then he was moved to a place in Long Island City, and my team helped pack up the room in hazmat suits. You don't find too many staff people that are willing to do that.
Yeah. That's
so
really
incredible. It's wonderful to work with such great people.
As far as housing and tying into everything else, there's about to be an explosion of in the homelessness crisis because so many of the programs are ending and there are going to be funding shortages. First of all, lower tax revenue. The specialty programs with eviction prevention are ending or will end. That's going to seriously affect a lot of people because I think one thing that this crisis threw a light on is the fact that a lot of people are 1 or 2 paychecks away from homelessness and don't even realize it.
Right.
Mm-hmm. I expect that we see our population to change a bit when people who have been living in an apartment for a long time and then they lose their job and all of a sudden they're homeless and they have no place to go. Many people are become homeless. They've been working. We've had people here that were earning over $50,000 and they lose their job and they use up all their savings and then they wind up in a transitional housing program. And I expect that we will be seeing more of that.
Yeah. Another piece of it is that the housing programs that we have really don't break even financially. They all lose money. There's not enough money put into these grants. So without the AIDS Healthcare Foundation, they're supporting our deficit. So we know ACQC's been doing housing for 20 years. We know when we took on housing that we're facing losses, but it's the need of the community. It's the need of our clients. So we continue to apply for the grants knowing that they won't break even. But we're lucky that our affiliate is taking care of the deficit. Otherwise, we could not run these programs indefinitely unless they gave us enough money to support them, which does not happen.
Okay. Now, along with the housing programs and the other programs, how do you have people needing transitional and permanent housing, and while they're going through all of this, there may be the medical crisis that comes along, there may be substance abuse, there may be just other, just basic personal and emotional support. How does that tie into the other programs that ACQC offers? Maybe Dawn, I don't know if that's your purview.
Sure. It works really, really well. The way ACQC operates is that we work as a whole. Mm-hmm. We treat the person as a whole. So although someone may come in and say that they are homeless, we do an assessment to find out what other needs that individual may have. So if that person needs, let's say they have something that mental health, or they have some sort of behavioral health, substance abuse, or they need extra case management, we have all of that at ACQC. So the person immediately can be referred not only to housing, but they can get treated in our Article 31 licensed mental health department or clinic. We have AHF, which has a clinic for medical, and a pharmacy also. We have case management that the person can continue to be followed throughout their time being at ACQC as a client. We have a legal department. So if they have an issue where the landlord is trying to evict that person, we have legal. We have legal that also works with them with regards to immigration, because we do have a population of undocumented clients. We have legal also help them with benefits, SSI benefits, SSD benefits. And then we have education and prevention, which also comes on board, where we do testing, and we do linkage and navigation. So ACQC is a one-stop shop, and it's a very holistic approach that we take. You know, I'm really proud in the direction in which we are going as an agency.
Mm-hmm. Well, it's like even I remember visiting when it still has a bit of a homespun family feel to it, but its outreach as an organization and as a community service has really expanded, and from what I'm feeling from everyone here, it still has the internal feel of a family and a homespun organization. That's wonderful.
Oh, absolutely, absolutely. During COVID, at the height of COVID, our staff, we opened up our community pantry, and we were out there handing out food. And also during that time, we were delivering food to our clients who were home-based and to families who could not get out. And our staff stood during that time and took care of it. Judy's programs were open. Clients were still coming in. We had our Syringe Exchange program. They were going out in the van to make sure that clients who needed their syringes exchanged or testing, whatever they needed, we had it done. And all of our sites, Woodside, Jamaica, Maine, and Far Rockaway, because we do have our Far Rockaway, they all open up to the community to make sure we had food.
Yeah.
That's great.
We're the only site in Far Rockaway, in the Far Rockaway building. We are the only organization that has been open and in our building and providing food to the community, providing access to getting nutritional care. I mean, the line is around the corner, over 200. We have to cut it at 200 because that's all we can afford to do.
Oh, wow.
Yeah.
And that gets back into, you know, not only the fact that you support the community, you need the community's support. So
exactly.
I'm gonna I know you're hesitant to bang that drum, but I'm gonna keep banging that drum for you. It's like
Good.
donate, however you can do it.
Thank you. We need it.
We do need it.
We need it.
Gotten additional dollars during COVID, but those dollars already ran out. So we need additional money because there's such a need. I mean, in all of our sites, we used to give 75 each day of food in each of our. Woodside would do 2 days a week, so at 150. Here would be 150 a week. In Rockaway would be 150 a week. Now it's 200 a day. I mean, we can't sustain it. We don't have it to sustain it, but that's the needs that are out there right now.
Mm-hmm.
Aside from the food, we also have a lot of people that are coming in who are homeless, who have been on the street, who are coming out of the prison system, and they have absolutely nothing.
Exactly.
They get, if they're lucky, they get maybe $100 from the city to buy some clothes. So in all of our programs, we try to supplement and help people get clothing and toilet articles. And we've had people come without shoes.
Mm-hmm.
And we have a nice fund for client emergencies, and we can always use some additional funds for that.
Well,
We
that's,
also, just so you know, our Syringe Exchange program is out in the community in the mobile unit every day. So we had to support the mobile unit because that was the only thing that was available to some of the community members with food, with toiletries, because they are also reaching out to a homeless population, and the lines were unbelievable. I was getting calls from the coordinator of the Syringe Exchange. Can I have some money? I really need to support this because we're the only ones here and they have such a need. So ACQC was able to donate money so that they can go out and buy additional hygiene kits, additional food supplies, because they were lining up at the van just to come in and get some additional, other than syringes, additional support.
well, it's wonderful that the support is there for those who are in the community that need it, but there's also the need for prevention to keep the foundation so that more people, you don't, to avoid the revolving door, if you have the prevention foundation laid, people won't require as many services in the future. So how does that play in?
Ali?
Well, even though with all of this that's going on, there was a time that the Woodside office wasn't open, but we were still like providing services online. Thank God for Zoom. This is like something that became a norm. So like we couldn't have our groups in the office, so we had it online. And that's something that the community was very happy within our men's group, our women's group, and also for our youth programs as well. Not okay with Zoom. We had social media with Facebook, Instagram. They always like will stay in tune. Also, if we couldn't provide testing or they didn't feel safe going to the office to get tests, we were sending them tests at home. So we would just get a simple demographic from them and then mail it to them, and they could get tested at home. And of course, with one of our outreach navigators or testers, they will be with them on the phone, so then they could guide them through if they needed counseling. And if one was become positive, then we will guide them through, so then they could get linked to care. Or if they wanted to get linked to PrEP or PEP, we help them with that as well. As they mentioned earlier, also with the food pantry, like that was something that we started like only providing it once a week, but then like with the high demand, that's why we continued doing it twice a week, because it was a lot. And seeing so many people making the line, like we would tell them that it's at 10 o'clock. People start forming the line at 8 o'clock in the morning because they knew that they were gonna go home with food and good food, may I add, too, thanks to Driscoll and all the donations that we've been getting. Also, with even like we've been saying like family, and I must say like within the staff, but also like I feel like we're very lucky and fortunate to have great peers within our organization, because our peers, they're part of the community, but they also like they fit the demographic, but they've been around for so many years, and you tell them like we need help, and they're like when and where, like we'll be there to be helping. So, but now we are open, as Rosemary mentioned, and we've been providing testing by appointment though, but people have been coming, and also trying to link them. If they can come in, we've been linking them. One thing that also Rosemary mentioned, like we have the affiliation with AHF. Luckily, we've been testing our staff for COVID-19, but for the antibody, and a lot of our staff has been getting tested, especially like the ones that are coming back to the office. So that's been good. So everybody could be healthy, taking the temperatures and all of the above. But one thing I wanted to add to, in conjunction with the family, like feeling like a family, and I mentioned it to Rosemary yesterday, a lot of our community members, they want to like meet in body now, but it's like, okay, we're still taking it like safety comes first. But we're just thinking around how we could link with them in a safe and healthy way.
Well, that's wonderful that you're not only taking care of the clients, you're taking care of each other and maintaining a community space that is safe and accessible.
Yeah.
So I'm very grateful that everybody's doing that, and I just want to take a second to remind the viewers that we are sort of doing an ACQC AIDS Center of Queens County 101. I've got a plethora of guests, and right now we're kind of talking about prevention. In what that goes, that's kind of where we are in the timeline. So I want to just say somebody's coming of age, and you're teen, hormonal, and hoping to find or someone you've been seeing for a while and you're planning what you want to be a safe encounter. What if somebody doesn't know what PrEP or PEP is, or is insecure about getting other things for safety, condoms, dental dams, or even just, or more especially, just the basic information on how to stay safe? How did they go to acqc.org right now, and then they find out where you are, how to access that? So what's the process with that when they do reach out to you?
Depending on their locations, we try to accommodate them if they're closer to the Woodside location or to Jamaica or Far Rockaway, and then we'll move it on if they want to come into the office. If they don't, we offer them the home testing kit. We want to make them feel comfortable as well. As the staff, we feel like family. We want our community members to feel the same way as well. Like it's their second home, and especially with this pandemic, so then they can know that they have a safe net,
a safe space.
Yes.
You brought it up in the conversation. I just mentioned PEP and PrEP. What's the difference between PEP and PrEP?
With PrEP is pre-exposure of HIV. So it's a daily pill that you take every day that is prescribed thanks to our lovely AHF, and they'll take it every day at the same time. They need to keep a regimen, and it just helps prevent HIV with the help of condom as well.
Right.
With PEP is the post-exposure. Let's say we have somebody that calls and said that they have an incident, depending how many hours. It needs to be 72 hours or less, and then we can link them. We have linkage to care for that as well, to link them to PEP.
So if somebody had an oops, they can call and get the information, and hopefully the post-exposure prophylaxis that they need through ACQC, just by calling in or visiting acqc.org.
Yes.
They will be linked to AHF, that they can get the medication that they need free of charge. Just as soon as they come in, we get one of our case managers, navigators, who will ensure to take them through the maze of where they need to go. So we know that people who come in and they're scared, they're nervous about this. So we always have someone who would truly take them through the steps so that they are comfortable. By the time they get to see the doctor and get to the pharmacy, they're comfortable and they understand exactly what's happening to them. So we do have steps, and we do have navigators who take them through those things. But we have peers also who help with that type of work.
That's wonderful, because you go into panic mode, and sometimes it's just a matter of the sense of security of somebody holding your hand and guiding you through a process.
Yeah, and also during that step, we have our behavioral health, the clinic, the director, she will be notified. Case management is notified. So some people may not be able to take it as well as the other person. So we always have someone on board who is willing to ensure that person that we are here for you, what your needs are, and to counsel them. We have all of that. And our navigators and our Ellie and her team, they are all trained as counselors. So they understand that someone is positive, how they should speak to that person.
Jonathan, no matter what door you walk in at ACQC, or what telephone you call into, or whether you do it virtually, we embrace everyone and connect them to where they need to be. That open door wraps around the whole agency, and we treat everyone with respect coming in and trying to really connect them in all the services that are needed.
Yeah.
That's what makes it special.
Yeah.
A few years ago, we had a survey I think AHF did it, and they sent people in to see what we do and how we do it, and they wrote up a report. And they said the secret of the agency is the staff. And they expressed it in the secret sauce.
The special
Is the
sauce.
staff. The
We have
special sauce is the
sauce.
staff. I think that it's very hard to find an agency where so many people are not doing this work for a paycheck. They do it because they really care about people and know how to show kindness as well, which is very important nowadays.
Yeah,
Especially-
the passion to help in the community.
Yeah, I mean, we definitely need a lot more kindness in this world, especially when people are facing divisions and needs, and it's definitely an organization that puts the client first. Where so many people are being very me first right now, and it's wonderful that everybody here is working toward the better of someone else and the better of the community.
Exactly. We had to redesign ourselves, especially in prevention, because, prevention's out there mobile, they're in the community, they're doing testing. We had to go virtual really quickly. And I was very concerned about the LGBT homeless youth population that we service in Woodside, and how we can maintain that connection and make sure that they're safe and they're being supported. And the staff were able to turn it around. I mean, within a week, we were doing virtual groups, virtual instruction, amazing, across all levels.
And tutoring too.
And tutoring.
Yeah.
Well, that's wonderful, because I know when I was coming of age, I knew I didn't know where to reach out for, even just for a sense of community. And that's something additional that ACQC helps to provide, whether it's in person or now virtually. It's wonderful. You had mentioned briefly homeless youth. How differently is it addressed differently than the homeless adults who's trying to get back to where they were? Somebody ran away from home or was kicked out of their home. How do the housing services differ in the needs? Or am I expressing it poorly?
Well, no, you are expressing it. The issue with homeless youth and housing is we rely on other providers for that and making referrals to other providers for that, like Callan Lord. In the city, we have connections with Covenant House, Sheltering Arms, to try to make those referrals, because our housing program right now is HIV adults. We do not have housing. We have our LGBT homeless youth center is a drop-in center for during the day. So when those individuals connect with us, then we have to see what their needs are and make other connections for them, which is really, in Woodside, we ran a summer camp last year. I mean, and they were asking for 2 sessions this year because it was so affected. We had to cap it out because all these young people wanted to come to us for summer camp. And believe it or not, they had to get parental consent, and their parents were signing off on this, or adult signature on it. And we had the most beautiful summer camp where all these young people were so accepted. And that's the issue out there, is that the acceptance, whether you're straight, whether you're gay, whether you're transgender, whether you're lesbian, they all come together. And that is the success of ACQC and the success of our youth program. And I'm sure Ellie can attest to that. We really embrace everyone and support everyone, whoever you love. Okay, so that's a real important piece of ACQC. We had a death of one of our staff during this pandemic, and the death was for one of our staff members who was a client, who became a volunteer, then was a staff member, and she was transgender, okay? And she died of COVID. And she died of COVID because the stigma in medical care is still there, and she was afraid to go to the hospital. We had this whole virtual memorial for Lorena, and she was like the mother from trans youth to trans adults. They loved her. She was somebody that worked 24/7. And in the midst of this pandemic, she was still, all these years that she was here, as a client, as a volunteer, as a peer, as a worker, still too afraid to go into the medical system for fear that she wouldn't be treated appropriately.
And
And she died. She died.
Yeah. And in New York City, nonetheless, it's a progressive town.
Exactly.
Queens.
And she was progressive. But
This is a person who advocated for hundreds, maybe thousands of people, but she was afraid to go to an emergency room for herself.
That's tragic on many levels. Yeah, the tragedy of loss and the tragedy of that fear should still exist.
it does. It really does.
And I guess I would think that would play into many of the programs that are available for supports, because the support programs not only form a sense of community, it forms a sense of self-esteem.
Right. We were having between up to 70 transgender women at our Woodside site, and I just have to give this plug because that came without funding. We don't have funding to do that, but ACQC sees it as a need. So a lot of the private dollars coming in, I give them money here, money there, I give them a safe space to meet. But that program is inadequately funded. And we try to make it the best we can with the resources we have. And if I get some additional resources, if I get someone that's going to donate unrestricted funds, and I say, okay, either put it into our food program, our transgender program, our youth program, our housing program, areas that were underfunded, and then we use that money that way.
And going to repeat again, say people can find out how to support you in these programs by going to acqc.org or calling the phone number that's on the website. And you need funding.
Yes, we do. We do. Luckily, we've gotten, we get city council discretionary funds for some of our programs. We are grant funded, but they don't pay for everything we do here. I mean, ACQC has always been, what are the community needs? Our Syringe Exchange program identified an area that the homeless were congregating in, and they needed coats and they needed gloves. And so in January, I just said, take $2,000, go buy what you need, and go give it to that community. Because they're too afraid to go into a shelter, too afraid to go into a program. But they were literally really cold out there, and we did what we could. We gave what we could.
Okay, I mean, there's so much that you do. There's so many people whose lives have been positively affected by everything that's been done for since the inception of ACQC.
Right.
Where through COVID and beyond, what would you like to see happening going forward? As far as outreach, as far as programs, the dream program that you would like to have set up, even if it's a sub program of the other divisions.
I think that we'll probably all have something to say about this, but you know, as you know, Black and Brown community here in Queens has been disproportionately affected by COVID. It really has. We at ACQC, as we talked about housing, we have housing for HIV positive adults. We service about 40% of our population now are at risk, chronically medically ill. We need other forms of housing here that we currently don't have. Okay, even though we apply, we're currently not receiving funding to service those with chronic medical conditions that may not be HIV positive. Okay, we have our youth program that, again, some housing for, and there is housing out there, but there's not enough beds for adolescent homeless youth. They're just not. It's if you have, I'm just giving an example, if you have 5,000 youth and you have 250 beds, you see the discrepancy there. As we talked about our food disparities, you know, people need food. People are hungry. People are out of work. I mean, so many people are out of work and need support at this time. You know, we always remember that client during Christmas who this young boy, they were here from Mexico and the mom passed from HIV and the father was HIV positive and he came in Christmas time and I was trying to give the young boy a toy and his response to me was, I want that can of corn instead. You know, that's similar to what still happens here where people are hungry. So food disparities is another one that we really need to address. So I guess people, the stigma that still happens in the communities. I mean,
but there's even stigma within the community of other areas of the community.
Exactly. Not my backyard. You know, I'm fighting now. I'm part of a housing advocacy group here in Queens. And because a lot of our clients, we have to house out of the borough. And there's so many properties that are not being utilized here right now. And we have like 42 agencies that are meeting together. Why not let one of these state or city or federal properties that we can develop affordable housing here? That is such a need.
Well, it's, I think, yeah, the NIMBYism, the not in my backyard,
Exactly.
does play a lot. I know there was an owner of two motels in Eastern Queens. The city was actually renting them out for abused women and children, and in this little town, you know, all of a sudden, the politician who wants to get attention is organizing people to march against housing abused women that aren't causing any trouble in the neighborhood. It's giving them a safe space, and it's just, you know, rallying up, again, the NIMBYism, not in my backyard, not in my community, but offering no other solution.
Right, right. We just had the same issue. We had to move our Syringe Exchange program because another provider in a different building started to complain about our Syringe Exchange program. Our Syringe Exchange program has been there 10 years with no incident. So we had to find another site because he was rallying up the community, and, you know, we had to move. We had to move. So acceptance and kindness would go a long way, and support of programs that are so needed. Knock on wood, and, you know, we're pretty in a good spot, but we don't know how what type of cuts are coming because of all the money that's being spent in other areas.
All the money that's being spent in other areas and the decrease in tax revenue.
Exactly.
Globally.
Yeah, so we're concerned about how this is going to affect us, and we really don't know yet. We were very lucky that we've been able to work through COVID. We faced no layoffs, no furloughs. Everybody was working, and we're hoping to continue that. We're hoping that our federal, our state, our city dollars continue at a level that will be able to sustain ourselves.
Okay. Gonna go around a little bit. Rajin, if you were making a pitch to the community for what you do and how people could access the services, what's your voice in reaching out?
So one of the challenges, the huge challenges, is, like as Rosemary said, is housing for the youth. So that would be a big one, and also for seniors. We're lacking housing for our seniors and for our youth. So my pitch would be support us in helping to house our homeless youth and our elderly seniors in the HIV and non-HIV community.
That's wonderful, because even as I was preparing this, I'm over 50, but the thought hadn't even occurred to me about addressing the issue specific to seniors. Yeah, and I'm on the verge of crossing that line very soon. So it's really something to think about, and something that people need to keep in mind as they look into where they can service needs. So thank you for bringing that up, because again, it didn't even pop into my head, and if it didn't do that while I'm preparing for a show specifically to address community needs, then it must be blind to a lot of other people.
Absolutely.
So, Judy, does that kind of tie into your view as well, or is it?
Yes, we have several clients that come to our program who are seniors, and it would be wonderful if there were more opportunities, more apartments, housing programs specifically for people who are seniors. What I also wanted to add was a lot of people don't know that now, in order to get enhanced benefits through HRA, you can be undocumented. You can be housed. You might not be entitled to cash benefits, but you can get emergency housing. A lot of people don't know that. We have people that come here that have been couch surfing and living in the street when they could have been in a safe environment. Mm-hmm. And because of all our wraparound services, they get legal assistance, mental health, medical care, pharmacy care. So I think it's important for people to know that.
Yeah, definitely, absolutely. Dawn, what's your pitch to say, hey, help us, come be with us, and this is what we can do for you?
You don't want me up there. I would scream about everything, because we really, really need the money. We need the funding. We have our drop-in center that needs extra money for our youth so that they can come in and use the computer and they can get jobs and they can be productive in the society. We need housing money. We need extra emergency money. We have programs that does not give us social security deposits. So we need money for that. We need money so that when clients come in and they don't have a coat in the wintertime, or like Judy said, they don't have shoes. We need money for our nutrition program, community nutrition. We got some money for COVID, but it's done. It's over. When 200 people line up, that's 400 people in 2 days. That's a lot of money. So we need money for that. We need money for our, for instance, our at-home testing. Mm-hmm. That's only a very small, that's for now. But I would love to see that continued. Are we going to have a grant that picks it up? Hopefully. But can we do it through maybe the assistance of AHF with some funding towards that? It will really expand us. Acqc has been around for so long. We have been in the community. We have been working with people at the lowest of low. We need it. We have legal services. We need money also to assist people who have to submit their documents.
Right.
They don't have money. A lot of undocumented people, they don't have money to do that.
Right.
You know, I would love to see us really, actually, the truth is ACQC is moving towards a little more advocacy. We have been advocating, but now I'm seeing us on this big old platform and we are out there like, give us stuff. We demand it. You know, we do Black Lives Matter. We are out there for more funding for clients, everything. We are here and we are not going anywhere. So please assist us so that we can continue to provide for our community. And our offices are located in not the rich neighborhood. We're in the poor neighborhood. And unfortunately, gentrification might push us out, you know, because they're buying up the buildings around us. And who knows if you can continue to afford the rent in these neighborhoods. But if people would donate, and remember that we're doing this for a good cause. We would love to expand our services, not only for people that are HIV positive, because we have programs in our case management, like our health homes, who see clients who are have chronic medical illnesses, but they're not able to get as much as they can because they're not HIV positive. And these people are also homeless, some of them, but they have chronic medical issues. So we would love to get funding to help everyone, you know? So yeah, I told you, don't get me up here. I'm like, I'm very ready to go.
We can have you back and just give you a soapbox and you can preach. Ellie, what's your pitch?
I can't wait, like I was telling Rosemary yesterday, I can't wait for us to be out and about in the community, testing, just unfortunately with all of this madness, but doing it in the safe way and to accommodate our community members to have groups outside, because that's what they want. They just want to feel the need of being in a family again, and just having the staff, all of us together again, and just looking forward for new faces to come to our offices, our social media, because that's where we're keeping engagement with our community members, and new faces too, not just here in New York, but we even have like followers from California, like everywhere in the United States. So we're just looking forward for more new faces. So
you'll have new faces in person soon, and I'm sure you'll have new faces by Zoom. So you'll probably see them on the screen first, and then somewhere down the road you'll be able to give them a hug safely.
Yes.
Rosemary, just to recap in the last few minutes, can we just recap an overview of the services that ACQC provides and where people can reach out?
Okay, so ACQC services the whole entire Queens community. So we have sites in Woodside, sites in Jamaica, sites in Far Rockaway, and we have comprehensive services. So people can come in for mental health services. We have an Article 31. You can see a clinician, you can see a psychiatrist. We have case management services, prevention services, nutritional services, an ADAP program if you don't have medical insurance and you're HIV positive that can connect you, legal services, and all of these services, just so you know, are throughout Queens. So whatever you have in Woodside, in Jamaica, and Far Rockaway, they're at each of our primary sites. So we are there, our food pantry is there, not only for people, not only for our clients, but for the community. So there's a community food pantry at each of our sites. Our Syringe Exchange goes throughout Queens. It wraps around Queens, sometimes in Rockaway, sometimes in Jamaica, Long Island City, Woodside. It wraps around Queens. So we are a Queens provider. We are everywhere. We have harm reduction services on site. We also have housing Housing's a big one. So, and we have people waiting sometimes to when's my apartment becoming available? But we have housing throughout Queens. So, and through the other boroughs. And we connect people to care. So we have a CCR program. So somebody is not connected to care, we connect them to care. So that is, we have 32 programs. We service over 10,000 people in a given year. More than that with our prevention programs.
Mm-hmm.
We have excellent staff. All of our staff will welcome you no matter what site, whatever telephone, whatever coming on to the computer. We're there to welcome you. And I want to thank you, Jonathan, for having us and for highlighting us. I really appreciate that.
I'm always happy to. Like I said, I think the second and third show that I did 25 years ago involved ACQC, and I'm always happy to reach out and work together and raise awareness and bang the drum that you're not only helping people need to help you, and people can find out how to do that at acqc.org or by calling what number?
718-896-2500.
So
that is our main number.
Okay, and I want to thank you, Rosemary, Dawn, Judy, Ellie. It's been a great hour. I'm so happy to have all of you, to see all of your shining faces. I hope, again, sometime in the near future, we can have a big group hug.
Okay. Sounds like a good plan.
We're gonna have to settle for little boxes.
Take care.
Thank you so much, and I want to thank everybody for watching. I'm John Griffith. This is Talking About. You can catch past episodes. You can look at all the shows that we did with ACQC before on our website at talkingabout.info. You might have to hunt for them, but most of them are there. So thank you for watching, and I will see you next time. Bye.
Thank
you.
Bye-bye. Thanks.
Bye.